Virus source. Chinese health authorities were the first to post the full genome of the 2019 nCoV in GenBank, the NIH Genetic Sequence Database, and in the Global Initiative on Sharing All Influenza Data Portal, an action which has facilitated detection of this virus. 2019 nCoV is a beta coronavirus, like MERS and SARS, all of which have their origins in bats. The sequences from US patients are similar to the one that China initially posted, suggesting a likely single, recent emergence of this virus from an animal reservoir. Understanding the origin. Understanding a disease's origin story is important, both because it helps epidemiologists track and prevent its spread and because a virus's genetic makeup can inform the design of vaccines and treatments. The details of a contagion's provenance can also help policymakers figure out how to prevent future outbreaks. As a new coronavirus spreads across the globe, scientists are working to understand where it came from. In the earliest days of the outbreak, the prevailing theory held that the virus came from a Chinese wet market. These marketplaces sell living animals along with meat and produce, and often feature creatures caught in the wild. But experts now say the Wuhan coronavirus's true origin story is likely more complex, and are encouraging a broader search for the disease's source. The WHO also says an animal source appears most likely to be the primary source of the outbreak. Snakes, including the Chinese krait and the cobra, may be the source of the newly discovered virus, according to Chinese scientists. But researchers are a long way from knowing where 2019 nCoV came from. Sequencing the disease's genome and comparing it to other strains of coronavirus, such as severe acute respiratory syndrome, SARS, Middle Eastern respiratory syndrome, MERS, and even diseases that only affect non-human animals, has yielded a solid lead, which may be somewhat similar to a bat coronavirus. Bats are believed to have been the source of both SARS and MERS. They have an unusual immune system that can tolerate many different viruses without harm, including rabies and coronaviruses. And their ability to fly, he adds, brings them into contact with lots of other animals, which increases the likelihood a disease will evolve and spread. Even if bats are confirmed as the original culprit behind the contagion, their involvement won't tell us exactly how 2019 nCoV got from them to us. Early reporting on 2019 nCoV suggested that many cases had connections to the Huanan seafood market in Wuhan city. Chinese state media reported that 585 samples taken at the market yielded 33 positive matches for the coronavirus's DNA, 31 of them in the area that sold undomesticated creatures like beavers and snakes. The results suggest that the novel coronavirus outbreak is highly relevant to the trading of wild animals. But outside research into the illness suggests that the disease may not have come from the market after all, rather, it may have come into the market. Since the virus seems to have an incubation period of up to 14 days and the first reported case emerged on December 1, 2019, it's possible the initial human infection took place in November. And since the virus presents only cold-like symptoms in many individuals, patient zero, whoever they are, could have spread it to others long before health officials knew what to look for. That means it could have infected humans. How does it spread? Coronaviruses like SARS and MERS, and now 2019 nCoV, probably spread between people similar to other respiratory diseases. Respiratory droplets from an infected person's cough or sneeze can carry the virus to another person, something that generally happens between close contacts. The Wuhan coronavirus is most likely transmitted through coughing and sneezing, as is the case with influenza and other respiratory viruses, Dr. Vaishampayan said. Scientists are scrambling to understand how easily the virus is transmitted. A close examination of one family, published on a medical journal The Lancet, suggested that the virus was passed from one ill relative to 6 others. Only 2 had contact with the initial patient. The Chinese Center for Disease Control and Prevention analyzed 198 confirmed cases in Wuhan. Researchers found that 22% had direct exposure to the meat market, and 32% had contact with people who had a fever or respiratory disease. But roughly half had neither been to the market nor had contact with anyone who was sick. 16 healthcare workers were infected while caring for patients, the report said. Researchers at Imperial College London estimated that in the current outbreak, each infected person had passed the virus to 2.6 other people, on average. But statistical models produced so early in an outbreak often turn out to be wrong. Because severe coronaviruses infect deeper parts of the respiratory tract, compared with the kinds of coronaviruses that cause colds, people tend not to be contagious until they start to show symptoms. In previous outbreaks, if somebody was going to get infected from an infected person, the virus had to get up into the upper airway so it could spread, research says, which wouldn't happen until the patient was sick enough to start coughing. Unlike SARS and MERS, however, there have been some reports of people without symptoms spreading 2019 nCoV, Chinese officials announced January 26, 2020. And because people might be infected and not show obvious symptoms, doctors should isolate patients and trace their contacts as soon as possible, researchers report January 24 in The Lancet. Asymptomatic transmission is common for contagious viruses such as influenza or measles but would be a new feature for the types of coronaviruses that cause epidemics. It could make the outbreak harder to control because such patients can spread the disease without signs that they're sick themselves, making efforts such as airport screenings less useful. But asymptomatic people have never been the major driver of epidemics. Current investigative methods and recommendations derive in some part from the experience of those epidemics. New coronavirus may spread through poop. New research suggests that it can also spread through feces. Previous tests have found that the coronavirus can be present in feces, but it was unclear if the virus would be viable enough to spread to another person, according to a previous Live Science report. So, a group of researchers analyzed stool samples from patients with COVID-19. They isolated the coronavirus from one patient who had severe pneumonia and examined the virus under an electron microscope. They found that the coronavirus was viable. This means that stool samples may contaminate hands, food, water, etc., the China CDC wrote in the report. People who use the bathroom and then don't wash their hands could spread the virus to others, for instance. This virus has many routes of transmission, which can partially explain its strong transmission and fast transmission speed, the China CDC wrote. To avoid feces contamination, the China CDC recommends washing your hands frequently, disinfecting surfaces, maintaining personal hygiene, avoiding the consumption of raw food, boiling water before drinking, disinfecting hospital environments. Another study, in the journal Emerging Microbes and Infections, found that the virus was present in blood and anal swabs taken from patients infected with SARS-CoV-2. Symptoms. Incubation period, how long it takes for symptoms to appear. The Wuhan novel coronavirus appears to be contagious before symptoms appear, as it is estimated to have an incubation period of 10 to 14 days, according to Ma Xiaowei, the director of China's National Health Commission. The World Health Organization, WHO, estimated this number to be between 2 and 10 days. This means that symptoms of the novel coronavirus, 2019 nCoV, may appear in as few as 2 days or as long as 14. during which the virus is contagious, but the patient does not display any symptom, asymptomatic transmission. Symptoms include sneezing, runny nose, fatigue, cough, fever in rare cases, sore throat, exacerbated asthma. There are some early reports of non-respiratory symptoms, such as nausea, vomiting, or diarrhea. Many people recover within a few days. However, some people, especially the very young, elderly, or people who have a weakened immune system, may develop a more serious infection, such as bronchitis or pneumonia. Two papers published recently in the journal The Lancet offer some of the first rigorous analyses of patients who contracted a novel coronavirus that has broken out in China and spread to other countries. Among their discoveries, the virus does not only affect people with other, underlying health conditions, and people who are not showing symptoms can still be carrying the virus. Clinical presentation. Chest radiographs may show bilateral infiltrates. Clinical illness varies from mild to severe. About 25% of confirmed cases have been classified as severe, and there are increasing numbers of deaths. In early cases, mortality was associated with advanced age or comorbidities. Diagnosis. Although respiratory infections, including influenza, are prevalent in the Northern Hemisphere during the winter, clinicians should inquire about travel history in persons presenting with respiratory illness. The possibility of 2019 nCoV infection should be suspected in persons who present with compatible clinical illness and exposure history. The World Health Organization, WHO, has slightly different criteria for whom to test, as noted below. Recent travel, within 14 days, from Wuhan, Hubei Province, China, WHO, CDC. Close contact with a person suspected or known to have an infection due to 2019 nCoV, WHO, CDC. The CDC defines close contact as being within 6 feet, 2 meters, or within a room or care area for a prolonged period without personal protective equipment or having direct contact with secretions of a person with 2019 nCoV infection. Exposure to a healthcare facility in a country where hospital-associated nCoV infections have been reported, WHO. The disease occurs in a healthcare worker who has been working in an environment where patients with severe acute respiratory infections are being cared for, without regard to the place of residence or history of travel, WHO. The person develops an unusual or unexpected clinical course, especially sudden deterioration despite appropriate treatment, without regard to the place of residence or history of travel, even if another etiology has been identified that fully explains the clinical presentation, WHO. In one study, researchers analyzed data from the first 41 patients who were admitted to hospitals with confirmed cases of the infection in the central Chinese city of Wuhan, where the outbreak is believed to have originated last month. Two-thirds had been to a large seafood market that also sold wild animals for meat and is thought to be where the virus jumped from an animal source to people. The median age of the patients was 49. The patients displayed a wide range of symptoms, many of which were similar to those caused by SARS, another coronavirus, which caused a global outbreak in 2002 to 2003 that started in China. All of them had pneumonia, and most had a fever and cough. Some people had fatigue. Rarer symptoms included headache and diarrhea. The researchers noted that patients with SARS more frequently had runny noses, sore throats, and diarrhea than those with the novel coronavirus, which is provisionally being called 2019 nCoV. One key finding. It's not only people with other health conditions that are getting sick, but the researchers also reported. Some of the fatal cases caused by the virus have been among people with underlying diseases like diabetes, liver disease, and hypertension, but the majority of the first 41 patients infected with the disease in Wuhan were healthy. The researchers noted that SARS infections similarly did not only affect people with other conditions. About a third of the 41 patients needed intensive care, and 6 of them died. Some of the patients with more serious illnesses suffered from a dangerous immune system overreaction called a cytokine storm, but the researchers said they still did not have a good understanding of how the virus affects the immune system. The second paper focused on one family who came down with pneumonia in Shenzhen. 5 family members had recently traveled to Wuhan and had the virus, as did one relative who had not traveled to Wuhan. So far, authorities have only confirmed human-to-human transmission of the virus among families and in healthcare clinics, settings where people are likely to be in close contact with each other, according to the World Health Organization. This appears to be the case with the family that was studied. Still, health officials do not know exactly how efficiently the virus can pass among people. One child with the virus did not show any symptoms. Health authorities have said that people with the virus have shown a range of symptoms, from very mild to very severe. But an asymptomatic infection raises the question of whether people have to be showing signs of the disease to pass it to people, a question that experts are rushing to answer. Because asymptomatic infection appears possible, controlling the epidemic will also rely on isolating patients, tracing and quarantining contacts as early as possible, educating the public on both food and personal hygiene, and ensuring healthcare workers comply with infection control. Dr. Kwok Young Nguyen from the University of Hong Kong Shenzhen Hospital, who led the research, said in a statement. In a commentary piece also published Friday by The Lancet, Dr. David Heyman, an infectious disease epidemiologist at the London School of Hygiene and Tropical Medicine, wrote that the picture these 2 manuscripts paint is of a disease with a 3 to 6 day incubation period and insidious onset. The researchers who wrote the 2 papers and other experts cautioned that these were small studies with limited numbers of patients in a rapidly evolving outbreak. But they noted that sharing information like this as quickly and rigorously as possible can help shape the response. How long can the new coronavirus last on surfaces? China's central bank is taking steps to deep clean and even destroy its cash out of fears that the new coronavirus can survive on the surface of money and potentially spread, according to CNN. But how long can the new coronavirus linger on surfaces, anyway? The short answer is, we don't know. But if this new coronavirus resembles other human coronaviruses, such as its cousins that cause SARS and MERS, it can stay on surfaces such as metal, glass or plastic, for as long as 9 days, according to a new study. In the new study, researchers analyzed several dozen previously published papers on human coronaviruses to get a better idea of how long they can survive outside of the body. The authors found that these coronaviruses can linger on surfaces for over a week, but that some of them don't remain active for as long at temperatures higher than 86 degrees Fahrenheit, 30 degrees Celsius. The authors also found that these coronaviruses can be effectively wiped away by household disinfectants. It's also not clear how frequently hands become contaminated with coronaviruses after touching a sick patient or contaminated surface. According to the study, the World Health Organization recommends alcohol-based hand rubs for decontamination of the hands.